Good morning, good morning. We're delighted to have you here. I just let everybody get in, get the audio settled. Okay, well, thanks for being here, everybody. We're delighted to have you here. We're just going to get going since we opened the room at just a little bit after 9:30. We are so glad you're here with us. And if you want to use just a little Zoom reminders, some of this is in the chat, I believe. We're going to use both the chat and the Q&A functions. So the chat button will be for introductions. If you want to tell us who you are, and maybe where you're joining us from, that would be great. The Q&A function will be for the content questions, and I'll be monitoring that. So let us know if you have a question about anything that comes up during the course of the webinar. The session's being recorded, and we will session is going to be recorded, and we'll email out a link to the session to the recording rather to everybody who registered. That'll probably come tomorrow, and then the recording will live on the Benefits Minnesota webpage on the Minnesota Council of Nonprofits webpage. So because Benefits Minnesota webpage is within that MCN webpage. And the closed captioning function is enabled there. And if you look at the bottom of your screen there, live transcript, CC, you can toggle that on and off if you want to adjust that. Thanks everybody so much for joining us. So I'm Margie Siegel. I'm the Association Health Plan Team Lead for Benefits Minnesota within the Minnesota Council of Nonprofits, and I use she, her pronouns. And then we have Jack Duffy, who's with Gallagher, benefits consultant, and Caleb Goldberg, also with Gallagher. And if you both want to say hello, you're welcome.
Good morning, everybody. Thank you for taking the time to join us. I'm excited for the next hour or so to learn and share more about Benefits Minnesota and the likelihood that it could be a fit for your member organization.
Good morning, everyone. Again, thanks for taking the time to meet with us this morning. My name is Caleb, one of the co-leads of Benefits Minnesota here at Gallagher.
Okay, so the plan for today, this is really the third, at least the third time we've done this webinar. We do it annually, and we try to update to make it, relevant, and also to share any new aspects of the plan that we think are helpful and relevant, of course. So we'll just have a little bit of overview about the plan. We'll talk about enrollment. We'll describe the plan levels that are available and the networks that are part of the plan. There's some important value adds we want to describe, that kind of the bonuses that come with Benefits Minnesota participation. We've got an administrative solution we are looking forward to sharing with you, and then we can look at the timeline, and questions are welcome anytime, but definitely at the end we leave a lot of time. We won't be taking your whole morning up here. Glad to have you. So Benefits Minnesota is a program. Benefits Minnesota is its own independent 501c9 organization that is sponsored by the Minnesota Council of Nonprofits. So that relationship between Benefits Minnesota and MCN is critical. And then we have other specific partners, Gallagher, Medica, and Capstone. Gallagher is the exclusive broker for the program. So we really rely on Gallagher to get the word out about Benefits Minnesota and reach all of our participants. And Medica is the carrier that we've selected. So all of the insurance benefits come through Medica. And Capstone is a new vendor. Capstone Administrators is a new vendor for us. They're the administrative solution, and we'll be talking about them a few slides down here.
And we officially launched on January 1st of 2020. So we're now entering what's going to be our 4th year. To date, we have over 100 member organizations. And from that, we have over 750 total employees enrolled. And then if you include dependents, that's over 1,200 total members. About 50% of the current groups are offering health insurance for the first time through Benefits Minnesota. And then about 3/4 of the pool have 10 or fewer employees, while those same 3/4 are roughly located in the greater Twin Cities area. So we range in size from 2 to well over 50 employees. There is about a quarter that are in greater Minnesota, but the scope of the organizations is broad. We have some arts, culture, human services, grant making, youth development, educational, and even environmental groups. So the diverse group within the Benefits Minnesota pool.
So Caleb alluded to it. We have a small nonprofit, we have large in Benefits Minnesota. The value proposition differs slightly. To give you a brief overview of the pricing and perhaps how it's different from the standard markets, we wanted to highlight on this slide for small employers or small groups, those with less than 50 eligible, benefit eligible employees, that is, the rates are the rates, the plans are the plans in most situations, meaning whether it's Blue Cross Blue Shield, Health Partners, Medica, United Healthcare, all their plans are filed with the state. They're community rated, meaning if you're a small group in, let's say, Mankato, Minnesota, you have the same access to rates and plans and carriers of another small group that is also in Mankato, and that won't differ between the two. So along with member organizations of the Minnesota Council of Nonprofits, asking for years and years for a solution that achieves scalability and the ability to negotiate better rates, better plans for nonprofits as a collective. Benefits Minnesota is a rare opportunity to deviate from those state filed rates and those state filed plans from the 4 carriers that I had mentioned. Certainly that is, very important in the value proposition. Price isn't everything, but price is certainly very, very important to us, to you all, especially as you look to attract and retain the best talent possible. That small group market, historically, since ACA, has operated with high single-digit increases. So whether that's budgetable, for every organization, that's debatable. Again, this is an opportunity to deviate from that and look to be incrementally better than what is out in the marketplace. For large groups, those that have over 50 eligible or benefits eligible employees, that is, the value proposition is slightly different because there is not exclusively a community, for lack of a better term, or community rates. So your individual utilization factors into the rates or factors into the premiums that are charged to your organization. It is certainly a far less stable market in that there are some larger nonprofits that might see a 20% increase in rates one year and 25% increase in their rates the next year because of how volatile their rates are. They lack the ability to spread the risk across their total population. Whereas the smaller organizations, those that are defined as small group, their utilization is just a drop in the bucket. They're one of many, many organizations. So for those larger groups, those larger employers that are considering Benefits Minnesota, there's opportunity for increased stability because of the scalability that we have achieved in really bringing the spectrum of, the largest of large increases and the largest of large decreases, almost together to a more manageable and more budgetable experience with their healthcare premiums or rates. So whether you're a small group, whether you're a large group, certainly there's value to be had in a conversation with Benefits Minnesota. We ask that you please don't, think of us as solely a small group solution or solely a large group solution or solely a rural or solely a metro solution. We really set out and have been successful in creating Benefits Minnesota as a solution that fits the vast majority of nonprofits that are headquartered in the state of Minnesota.
Regardless of what size organization you are, you have 5 different plan designs to offer across 6 different networks, and you can offer any combination of the plans and networks. Our plans vary in deductible and HSA compatibility. So we start with a $500 copay plan, and then we finish with a high deductible $6,350 HSA plan. Now, the networks and their utility will vary on your location, but for that being said, we do have a national network. So our Passport network is open access, and it's open access for Minnesota and for your employees that are in other states. Whereas the following network allow for cost savings so all for a select number of providers.
So coming back to the value proposition that I started with a couple slides ago, Benefits Minnesota is really built different than your standard fully insured, whether it's small group or large group health plan. It's closer to an individually rated large group than it is a community rated small group. So utilization does impact which rating tier or set of rates that a Benefits Minnesota member organization is placed into. So we do not have one rate for all member organizations. There is underwriting or a look into demographics and a couple other factors by Medica, the carrier, to deem which set of rates are appropriate for the overall risk of your organization. And I mentioned a couple other factors. Area, certainly geography is a factor in that, as is health status and risk. So this is really what allows us to deviate from the state filed rates and state filed plans and small group especially. Without it, we would not be able to provide an alternative to those rates in most instances. It's also, now it's different in many ways. Another way that it's different is we have 5-year age bands in those 12 rating tiers. Small group today, single year age bands. Again, we have 5-year age bands. Large group is typically composite rated or tiered in employee, employee plus child or children, employee plus spouse, and or family. So Medica does bill. Member organizations are invoiced in the 5-year age bands, but know that if you're a larger organization in particular and you're accustomed to the composite rates or the tiered rates that I had mentioned, you can work with your Gallagher broker / consultant to create those composite or tiered rates out of the age banded rates that Medica is billing. So important to note, through the scalability that we've brought forward with Benefits Minnesota, a couple other unique items that we've been able to negotiate on nonprofits' behalfs. Guaranteed issue. So a lot of nonprofits have dealt with lower participation than they would like, which is of course lower participation than carriers would have liked. So carriers will sometimes terminate a plan, terminate a member organization, and that member organization is then tasked with finding another carrier for the upcoming year, often a task that is difficult to come by when you have said low participation. So in Benefits Minnesota, you'll never be termed for low participation. We accept organizations from the onset, regardless of the participation that we're able to achieve in the plan. And even if when there are high claimants, know that that would also not lead to termination of coverage and the need to look at other carriers. So it might mean a different rating tier based on both of those items that I had just previously mentioned, but it doesn't mean that you'll be quote unquote booted from Benefits Minnesota. We won't and will not do that. So the retiering limits I alluded to right there, we want to make sure that there are levers and pulleys in play that limit your risk for higher increases, as I mentioned, that most larger organizations are experiencing or larger nonprofits are experiencing when they're on their own. So you'll never go up more than 2 tiers at renewal. So the tiers, most of them have a variance of about 5%. So that's to limit your overall exposure in year to year. There's also a retiering limit down. So if you're extremely healthy, experience really low utilization, there's also an incentive to remain with Benefits Minnesota in that your rates the following year might be actually less expensive than they are in the current year. And then again, through scalability, have been able to negotiate with Medica cumulative rate caps or aggregate rate caps for the pool as a whole, which further ensures that in the good years and the bad, we have increased security relative to what's available in the small group and or large group market.
Thanks so much, Jack. Caleb, can you, before we go to eligibility, can you back up now to the slide with the network and plans? Because, yeah, just pause right there. Thank you. Jack, if you could please, Caleb's audio was cutting out a little bit when he was talking about those networks. And is there anything more specific that you would want to highlight on this slide before we move on to eligibility?
Yeah, absolutely. So just to reiterate so that everyone can hear us this time, we offer 6 networks through Benefits Minnesota. Passport, Elect, and Clear Value are probably your more metro-based networks and would not, well, Passport is a national network through Medica. So that is the most common network that is actually offered through all of the Benefits Minnesota organizations. 98, 99% of providers, 100% of hospitals. That's where you're going to want to enroll. If you have let's say a primary care doctor at one provider and then a specialty doctor at another provider to ensure cohesion in your care. For employees and organizations that are in different pockets of the state, there's a couple other networks that are worth mentioning. So Complete Health is down in the Rochester area for those organizations. Essentia is up in the Duluth area for those organizations. Clear Value is here in the Twin Cities and limited to Hennepin Healthcare. So whether you're looking for a really robust network or whether you're looking for a really narrow network in that your providers, your doctors are in that network and you can achieve some scalability and some cost savings in the meantime, the combination of networks is really at the employer's discretion. So you'll have a conversation with Gallagher, talk about where you're at as an organization, where your employee is at as an organization, really make recommendations to maximize the plan and network offering that you're coming forward with.
Okay, we can just, before you can advance to eligibility there, Caleb, but I'm just open to any questions. And Jack, there were a couple of questions that I answered. One still outstanding in the chat box there. There isn't one deductible, though. There's those, was it 6 levels of deductibility and 5? Those are the network options. No, the plan options. And then the network options are the ones that Jack just described there. Are there any other further questions, though, that people want to take in before we move to eligibility?
Margie, I would like to add, if we can go back to the plans again. So the plans that we're leveraging in Benefits Minnesota are plans from Medica's large group portfolio. And I mention that because when we're asked questions about association health plans, there's sometimes an assumption that the plans are skinny down versions of what is otherwise available in the market. And that's not the case in Benefits Minnesota. These plans are just as robust, if not more robust than what is in the market today. We really pride ourselves on the strength of the plans that we're offering and believe that's a clear differentiator. So we have two traditional copay plans, the $500 and the $1,000 deductible. Both have $25 copays and 25% coinsurance that gets you to an out-of-pocket maximum. The 3 high deductible health plans that we offer, this is key to point out, 100% coinsurance. So once you've met that deductible of $2,000, $3,500, or $6,350, you're done for the year, which is really rare in our market today. Sometimes we see coinsurance, which has an exposure to the employee of 10, 20, sometimes 30%, up to a much larger out-of-pocket maximum.
Margie, is my audio working better now? Or is it still crackled?
Right now, it's good.
Okay. Well, and one more thing to add about the plan design. So they weren't arbitrarily chosen. We did do some extensive surveying to see what organizations and employees wanted to offer. We also see these plans being very rich in our benchmarking and very solid plans. So to reiterate Jack's points, these are definitely not skinny down versions by any means.
Okay, so I'm seeing a couple of questions in the chat, and I think the chat, if you could put those into the Q&A, that'll be really helpful. There was one person who asked about what plans, where were people getting insurance before they joined Benefits Minnesota? And I'll say straight out that one of the really kind of top things that we're proud of and just appreciate is that about half of the groups that are in Benefits Minnesota now, half of the nonprofits are new to offering benefits. They weren't offering benefits before. So that's just huge for us, because we really, you'll see with the eligibility, we really wanted to make the plans, make what we offer work for our smallest members and the groups that have been, for whatever reason, so either shut out or unable to consider offering this benefit. We really want to, the goal was to help make nonprofits better situated to attract and retain the best possible staff. And so the fact that we've got these new, that we've got all these groups new to offering benefits sort of underscores, yeah, our reach towards that. I'm still seeing the questions coming through on chat, and we need them on Q&A. Otherwise, I'm going to lose track of them. I'm going to move to eligibility and let Jack take a look at the Q&A going forward. So I guess just to answer the other question, the rest of that question. So nonprofits, the other groups that were offering benefits before they joined Benefits Minnesota, they had all different kinds of plans, and they were with different carriers across the board. So there isn't some sort of universal place that groups were leaving to come to Benefits Minnesota. Some of them were on Medica plans, and then they switched to Medica through Benefits Minnesota. So, but a lot, and then beyond. So I'm not going to name all those. All right. So in order to be eligible to participate in Benefits Minnesota, you have to, the organization, nonprofit has to be headquartered in Minnesota, but you can have employees elsewhere. Those employees then could, as Jack mentioned, I'm just going to jump because I saw somebody ask the question, they could enroll into that passport plan, and then they would be able to access their providers in whatever state they're in. but the headquarters has to be in Minnesota. You have to be a 501c3 member of the Minnesota Council of Nonprofits. So we've got some associate members and other types of membership, but you have to be a C3 to join. And you have to have been an MCN member for a minimum of 30 days. That's a state requirement, actually. That's, but yeah, you have to join Benefits Minnesota in order to begin the process. We are really pleased that your organization only need 2 benefits eligible employees. I'll talk a little bit more about that in a second here. There are really flexible participation requirements. Move to the next, please. And the renewals happen on a calendar year, so everybody has to begin. You can join any month of the year. You can initiate with us any month of the year, but the renewals are into Benefits Minnesota happen January 1 for the calendar year. The organization set their eligibility for those. So in terms of determining how many eligible employees you have in your organization, you can say, the organizations get to say, well, if an employee works 20 hours a week, they're benefits eligible. So the choices on that eligibility are 20 hours, 25 hours, or 30 hours per week. Seasonal employees are not included in that. It's a more specific case, and we could work through things with you on that, but typically that's not a fit for us. Even if you're a smaller organization with just 2 benefits eligible employees, one of those employees perhaps gets their benefits through ACA, through the open market, or through a partner or spouse. They're not required to participate in Benefits Minnesota. That one remaining employee who is perhaps particularly looking can join Benefits Minnesota. Yeah, and then that last bullet is just that right now MCN membership, which is a requirement for participating in Benefits Minnesota, we would sync that up to the calendar year. So your MCN membership can't be start on June 1st and go to May 31 or whatever. You would have to, we would work behind the scenes to make that work for you and prorate things so that everything comes out even for you. Are there any questions on eligibility that you want to have? If we offered benefits or 20 hours a week, is the employer still? Yeah, no, it's 50%. Oh, looks like Jack's typing. So we require that employers pay a minimum of 50% of the premium. Pretty sure that's correct. And you can go up from there, but the minimum is 50%. If a new eligible employee starts mid-year, are rates impacted? No, your rates for the organization wouldn't be, but that employee could join. I believe that employee could begin, so this is to Linda's question, that employee could enroll in benefits 30 days after the first month ends, something like that. So it's not immediate, not that day of starting, but quite soon after.
Yeah.
So rates,
Linda,
yeah, go ahead, Caleb.
Yeah, Linda, thanks for joining. It's nice to see you. So if an employee joins mid-year, the rates are not impacted. But if they if they are a new hire, their eligibility to join is first of the month following 30 days of employment. So if you hire them on the first of the month, they can join the next first. If they are a current member or a current employee and they wanted to join mid-year, they would need to have a qualifying event. So that would be maybe they turn 26 and are no longer on their parents' plan or something like that. Otherwise, they'd have to join during the open enrollment period.
These are all really important questions, so feel free to keep putting them in the Q&A, not in the chat. I know it's a little confusing because the chat's getting populated, but it's going to work better for the group here. if those are in the Q&A, and feel free to ask those specific questions about your organization or your situation, or yeah, no problem, because probably your question, as we all know, will apply to somebody else here. And yeah, we're here to answer. We're here to help you understand if this will be a fit.
A couple of things I want to add to what Margie went over. So while you do need 2 eligible employees to join the pool, there is no participation requirement. So as long as 1 employee is on the plan, it will stay in place. So while you need 2, as long as 1's on the plan, that's fine. And then, yeah, you can set eligibility on 20, 25, or 30 hours per week.
Caleb, you're cutting out now. Caleb, you're cutting out now. So sorry. I think we're gonna have to move on. And if you, I'm not sure what you were adding there, Caleb, but if there's something you want to chat with me on, you can send that to me.
How about now, Margie? Can you hear me any better?
Yes.
So briefly, just beyond the goals of accessibility, stability, and others like that of the true healthcare, there are a variety of value adds included in the program. These are just a few of them, so that we like to highlight. One is My Health Rewards Medica Invest program. It's a well-being program that allows employees that are on HSA plans to earn up to $900 per year. There's also an EAP program included, a mental health support app, Sunvalo, and then a pregnancy and parenting program called Ovia. Medica does offer the Optum employer trainings, which you can choose from a library of different topics to train employees on, whether that's, workplace harassment or dealing with stress or, grieving, things like that. There also is complimentary counseling included, and there's 5 sessions per year per topic. Beyond just the value adds, Benefits Minnesota does continue to evolve as an overall administrative solution as well.
From an administrative solutions perspective, it's important to us, it's important to Benefits Minnesota to build a solution beyond a health plan that's all encompassing and alleviates a lot of the administrative obligations that would otherwise fall on you, the organization. So to Margie's mention earlier in the presentation, we've introduced Capstone. That's a third-party administrator that will be supporting that. We've also will continue to provide discounted account-based administration, such as COBRA, HSA, and FSA administration, as well as offer enrollment solutions, such as one-on-one enrollments with benefit counselors that are educated similar to Caleb and myself to walk employees through all of their benefits, not necessarily just their medical plan, and help them enroll in the plans and the networks that make the most sense for their situations. Last but certainly not least, we offer voluntary and worksite benefits that really round out your benefits offering, take care of any gaps in coverage that employees might still have, such as critical illness and accident and hospital indemnity coverages that we're seeing increased popularity, especially in and with organizations that offer high deductible health plans, such as the ones we offer in Benefits Minnesota.
Sorry, I was muted. The Capstone, sorry, welcome. We're so delighted to be partnering with Capstone beginning in January 2023 officially to handle all of the enrollment and billing services and the accounting work on the background and some in the background and some risk mitigation services. I don't really want to share a lot of information about this now. They're new to us, but they've got a great platform, Benefit Solver, that we're going to be using. So when groups are joining, they're able to put in their enrollment information through this technical platform, right? It's a web page through the platform, and all of the billing will come through the platform through Benefit Solver. And it's pretty slick, it's pretty simple, and it's going to streamline for us a whole bunch of pieces that are going to benefit everybody. So I think that's all I'm going to say about Capstone for now.
And next steps for interested organizations is to reach out to us either through our landing page on our website here or out to us individually, and either Jack or myself or a colleague will get in touch with you and have a conversation. And what the timeline looks like. So you do need to get a quote for Benefits Minnesota before we have pricing information available. Once we have your application submitted to Medica, and the application will vary based on your size of organization and what you're currently doing for benefits. But once we have your application, you can submit it. They will return a quote within 10 business days. From there, we are able to spreadsheet your census and spreadsheet all the plan options that you have and really brainstorm what the best fit for your organization is going to be. This is just an expansion of a little bit of our timeline. But for interested organizations, we do have plenty of time for 1/1/2023, and we can even look at earlier start dates as well.
So let's just take a little bit of a look at the questions, because there's quite a few, and I'm really glad about that. Really glad. People are listening, and these are smart questions, some of which I've, yeah, Caleb and Jack, if you want to look back at what we've answered to make sure I didn't mess anything up, that would be great. How easy is it to locate providers in other states? Medica does have a website, and you can use that easily. Yeah, I've used that to find providers when you're traveling. So, and they've got great customer service, so that's not a problem. It's basically, isn't it basically United Healthcare's network nationally? Wouldn't you say? That's how it seems to me.
Absolutely.
Yeah.
And United Healthcare has the largest, or is the largest carrier across the country, with one of the largest networks. So it's Medica tapping into that network for the benefit of, no pun intended, the Benefits Minnesota member organizations.
So Capstone, Jennifer had a question about Capstone. They're not local. They're based in Indianapolis. They are also have a really high touch, high customer support capacity and availability. They just really live with this, and they're definitely available by phone and email. So yeah, you wouldn't have any problem reaching anybody there. Dependent coverage is offered. Yep, that's certainly something we work with. Is using Capstone optional? So several questions about Capstone. Great. So Capstone isn't optional. It's part of the plan because they're going to be doing the billing now. So the billing up through the end of this year is handled by Medica. Medica does all the enrollment and billing for the plan. And we are hopeful now that I guess from my vantage point, we're interested in taking the enrollment and billing out of Medica and bringing it to Capstone. It's not optional, because with that, then we think we'll have a slightly smoother path to adding on other voluntary benefits, including particularly dental, and then secondarily vision insurance. So we can begin to build out what Benefits Minnesota can bring employees. Those would be optional, of course, but we won't have to have separate enrollment and billing for different pieces. So Capstone is not optional. There is a cost. The cost is rolled into the premiums with on a per employee basis. So It's not annual, it would go monthly. Yes, you would pay a fee. Is there a rate range that you can share? Whoops. I think I've answered the capstone questions. You mean rates of premiums? You know, those plan levels, I'm gonna leave that one to the anonymous ones. Can domestic partners can get coverage? I'm leaving the 2 rate questions for Jack and Caleb. Do they also manage COBRA? They can manage COBRA. Yes.
They cannot manage Minnesota continuation.
Oh,
to
yeah,
this
right.
point.
Oops. Sorry, they can't manage COBRA. Jack, do you want to talk to those rate questions?
Is there a rate range that we can share relative to capstone?
No, I think it's premiums.
Oh, a rate range in the premiums. There's such a vast range that going through the quoting process and identifying which tier, which rating tier you fall into, would be my strong recommendation. And that a tier 1 has the lowest rates and a tier 12 has the highest rates. And how those tiers compare against small group or your large group rates, there's such a vast difference. Going through that practice will be most helpful.
Keep the questions coming. We're here. We've got another 45 minutes to answer questions, and we're basically through the slides. I think I'm going to let you take a look at those, Jack. Please let us know if we've missed your question, or if the answers weren't satisfactory, or if you want anything related to a previous slide. So Jack, does Benefits Minnesota also have options for FSA and DCFSA? Oh, you're typing on a lot of them.
Yeah, so we've been asked that a couple of times. I'd throw COBRA into that most certainly. On a couple slides ago, we alluded to discounted administrative services. That includes COBRA, HSA, FSA, FSA, drill down a little bit further, dependent care, or limited FSAs. Absolutely. The preferred vendor is MedSurity. They're a smaller, local, and more customer service driven administrator, and one that we're extremely fortunate to have brought forward discounted pricing with for Benefits Minnesota member organizations. So in conversation with Caleb or myself, would be more than able and willing to provide you with a quote for any which of those administrative services that you would like.
The rates for 2023 will be available, I think, October 1, if not sooner. But I'm going to say October 1. Yeah, you can get, Tim, you can get specifics without, you can get a proposal without changing your broker, but you have to go through Gallagher to get those specifics. Gallagher's the exclusive broker into the plan. And then if you decide you do your comparison and you look at what the value adds are with Benefits Minnesota and consider being a part of this member benefit, then you would change your broker if you decided to go forward. Broker for the medical services, for the medical benefits.
Margie, I would add
Yeah.
that if rates are available on October 1st, we want to begin our conversations immediately because there's information that we'll need to gather to be able to populate those quotes. And there's a 10-day turnaround with Medica that we want to be mindful of. Sometimes it's a little bit less than 10 days, but we want to be mindful of that so that we can get those rates into your hands as soon as possible, because we know that you have decisions to make.
Somebody's asked about dental and vision. We don't have an option currently with Benefits Minnesota. It's on the horizon. Well, it's on my horizon. It's on our horizon. But I would say if everything goes according to plan, which may happen, it would be 1/1/2024. I don't think it would start before then.
Currently, how that's managed is for the Gallagher clients that are in Benefits Minnesota, the dental, the life, the disability, the vision, we're still the broker consultant on, and we manage outside of Benefits Minnesota. So there's absolutely an opportunity to have a conversation about those lines of coverages as well. To Margie's point, the goal is to bring a similar vision of Benefits Minnesota with the medical to those lines of coverages and achieve additional scalability and cost savings for member organizations. So I'd like to have it maybe March 1st of 2023, but worst case scenario, January 1st of 2024, somewhere within that time frame.
You heard it first here, folks. That's good news. The open enrollment period would begin for January 1. It would open, I think, in November officially. But if you wanted to, if your organization doesn't have benefits now or has a renewal that comes up before January 1 with an existing carrier, you could, October 1 is too soon, but November 1 could probably happen if that was what you're aiming for. So open enrollment typically though will be in November on an annual basis for existing groups. Looks like you're answering current plan. I'm going to let that go. Do all the small business rules still apply? Is the coverage age banded with no options for family plans and fees per dependent? I think all this, I'm not sure what all the small business rules apply are, so I'm going to leave that to you, Jack.
Yeah. Coverage is age banded. So we have 5-year age bands in Benefits Minnesota versus the 1-year age bands that are in the small group market. The 50%, the minimum that an employer must contribute to the lowest valued plan that is offered from an organization, that rule still applies. That's 50% towards employee coverage. You know, to your point, employers have to offer at least the option for dependent coverage. They don't need to contribute towards it, but they at least need to offer it. And that would be dealt with in a similar manner. Each, let's say, dependent, whether it's a spouse, child, or other, would be subject to their own 5-year age band, and then added to the cost of the employee's 5-year age band for that total premium.
I am looking at Julie's question. More questions about Capstone. Are you taking the ability for small employers to just handle enrolling employments and administering benefits away? And we must now use Capstone, which requires employees to enter their own data and enroll themselves. I'm trying to understand this change. I mean, a lot of this would be automated. I think, I am gonna have to, I think, Julie, I'm gonna have to verify, make sure I'm gonna just cut and paste this question so I can answer it completely separately, because I'm not sure of the answer. Oh. I want to make sure I get that right. I think that the answer is yes, that employees would be entering in their own enrollment information, but the other related administrative pieces, Julie, for Capstone would be handled by most likely a single administrator. Certainly the billing would. So we want it, it's meant to be easy and straightforward and uncomplicated for both the HR or who's ever overseeing this capacity now, and for employees. It's meant to be simple and straightforward. But employees, I think, would be entering in their own enrollment information, and then I think small employers would be overseeing that process through the calendar year. I don't think employees would need to go in to look at things on any kind of regular basis.
That's correct.
Thanks. So here, the last answer down here from Corey Tentler, not to bring her out. I think, Julie, is to your question, and Corey is with Capstone. So, there we go. Employees don't have to have the access. So like I said, I think Capstone is really flexible and user-friendly and will work with whatever situation really that the employer prefers.
Right. There are a couple of situations that we want to acknowledge that some employers and member organizations might have another BenAdmin platform, such as Ease or Employee Navigator. We have a way to communicate the elections that are made in either of those to Capstone to populate Business Solver on the back end. So let's make that a conversation offline, with your Gallagher representative, and we can work through that together. But that's not a barrier from our perspective. And to another question that we face, long term, the goal is Business Solver will house not only your medical, but your dental, your life, your disability, and really remove the necessity of another BenAdmin platform. Right. So think of this in phases. Let's say we're phase 2. Phase 3 is adding those ancillary options. That would, again, eliminate the necessity for an Ease or Employee Navigator or other BenAdmin platform, and everything is housed on one and done through Benefits Minnesota.
So, Anonymous, I'm not sure that we got your question answered. In response to the age banding questions. Coverage is age banded for everybody who's covered, employee and spouse and dependents. They could pick different plans, different plan levels, but yes, age banded.
And if you're a large organization, again, coming from large group with more than 50 eligible employees, let's have a conversation. We have underwriters that we're able to work with and build those composite or build those tiered rates that you speak of out of the age bands that you have. Today, all the large groups that are in Benefits Minnesota have decided against that and are fine with age banded, but we want you to know that we have the capability to build those composite or build those tier rates that are employee employee plus child or children, employee plus spouse and family.
Are there any other questions? We're still here, and Jack and Caleb's contact information is here. I'm available through the MCN staff webpage, contact info if you need anything. If it's something that you want to think about for next year and just are here to gather information and, you know, begin that process of consideration, that's completely understandable. We do schedule this for the fall. Usually this webinar is in about this time of year because a lot of groups are beginning to look at their information for the following calendar year because most renewals do happen on a calendar year. And I don't know what you're doing, Caleb, but but we also know that a lot of groups will look at the slides during the course of the year or reach out in, you know, March or April when things are quiet. For whatever reason, you have the time and space to begin to consider this. That's fine. You can join. Somebody asked about joining mid-year, and that's fine. Then it would go for, if you joined in May, say, it would be for 7 months through the end of the calendar year, and then the renewal would begin for the full calendar year. So that's sort of why the timing is as it is here.
Yeah. If you made a mid-year change, if you went from, let's say, a small group plan or a large group plan with a Blue Cross Blue Shield, for instance, and wanted to join Benefits Minnesota because it made sense financially or otherwise, you absolutely could. Medica would honor dollars spent towards that deductible. So it wouldn't mean that each employee would have to start over in going towards or earning towards their deductible amount. So that is a really nice benefit. Keep that in mind.
I think Nancy's asking about new plan options for 2023. I think, yes, our hope would be that you would reach out now because changing plans and carriers and, you know, it takes time to lay that groundwork and to explain to employees and, you know, bring everybody along with it. With any decisions like that, I know, you know, if you've ever been with an organization that changed carriers, and it causes some, you know, it can be disturbing for groups, for people when they're, if they feel they're not going to get the providers and care that they're accustomed to getting. So even though that won't be the case because all of the providers are for sure in that passport plan, all of the specialists, there really wouldn't be any need to change for any upset for medical. But it takes a while to bring, you know, to bring a change like this through for employees who are used to a different system and a different look and a different, you know, arrangement all along. So I would say start, yeah. So we're at about an hour, and I think we still have more time for questions, or maybe you're reaching out to Gallagher by email now. I don't know. Otherwise, looks like several of you are still in the room. I don't know if you have questions. We're happy to entertain them, but you would have to type them in.
What we can do is officially wrap up the program, and then we can all just stay on here afterwards for additional questions.
Okay, that sounds good. So thank you so much for attending and joining today. We're delighted to have been able to share some of what Benefits Minnesota is about and what we hope we can bring your organization. And we would love to have a continued conversation with you separately. If you have any other questions, Jack and Caleb and I will certainly stick around a little while. And have a great day.
Thank you, everyone.